because what they have shown is that as you go later in the years, you're talking about the greater chance of dropout, not finishing high school, never going to college, not getting a good job, being unemployed, being poor, being this, being that. You really are parents, if you don't get your kids involved in VPK, you really are stifling their opportunity. And as these young people are stifled, our families are stifled, and our communities are stifled from being healthy and growing and developing as they need to be. To have this great quality of life that we all strive for and that we all deserve, but it starts early. It starts early.
And the fact in the last 10 years, there's a plethora of neuroscience and research and data to justify this. So this is why you've seen this major paradigm shift to investing in the first 5 years.
Mm-hmm.
Better than that, investing in a healthy pregnancy and a healthy birth outcome. And I've been promoting that forever, since I know Lawton Childs was governor. But and that is so essential now that we've got the knowledge base to know that. However, there are some external factors oftentimes in a family.
Mm-hmm.
And we talked about the poverty rate. We've talked about all of these indicators that adversely affect that opportunity.
Mm-hmm.
That doesn't mean you have to keep trying, and you must keep trying.
Absolutely.
And you go back to the screening. It's all. And I guess if I wanted to think of an educational moment, and the one is now, is that this community, it's incumbent upon us to realize that those individual programs must and should all work together from a holistic perspective and not in an independent one to give me mine, I need mine people's, because you get it perfectly. It's that whole child, it's that whole healthy baby, it is that getting that screening. I talked about Part C and the fact that we need the early steps. If we found a baby that has some delays, let's begin to work on it now. Better than that if we find a mother who doesn't understand about being healthy during pregnancy. So, yes, it's just that we need to share more, learn more from each other, and try to work together. And that's something I think every community can improve on.
Absolutely.
Because it's like protecting your own child. And this feeds right into the children's health piece because, and Lara and I say, all the educating, all the VPK, all the stuff you want to do, that child can't hear because he's got, stuff in his ears or he's got these problem child. You're not going to be able to educate them. So they are linked and essentially dependent on each other.
Absolutely.
Yeah.
Another thing I'm sure you guys hear from people too, and I hear it where people say, well, government shouldn't be doing such and such. People ought to be taking responsibility for themselves. Well, if you haven't started early on to help teach that and prepare the foundation upon which all of that builds, then what really should you expect as they get ready to, high school or, college or vocational training, whatever else? If that foundation is not there, how can you build on, shaky ground? I mean, you really can't. So we need to do the investment that's necessary at the early stage in terms of the children, but also in terms of their parents. Because another thing that came out from that session is that you could spend all the money in the world to get somebody healthy, but if you're going to send them back to that same sick environment, then you're just wasting your time and your money and everything else. Because it's like money down the drain.
But and it's a very pure, simple, rational thing. However, we can't deny the fact we have a whole cast of people and families that are already outside of that. And if we disregard them, you're going to see tremendous social, economic problems. So it has to be a fair balance.
It's got to be ongoing, all the continuum, that full continuum.
Not in isolation, but even like with the child's health. Okay, well, we've got Healthy Kids and Kid Care as part of our program, and Kid Care this year did get $4.5 million increase, 4%. We're going to have 11,600 more kids that can get into the program.
Wonderful.
Now that's the subsidized part. Medicaid is always open. But that's a big piece in a mindset of a state, although we've never fully funded it, because that's why we have 500,000 kids that are eligible but are still not in the program, and we need major health care reform on that.
And all of these, a lot of these are you're working for.
Yeah, but this year there was a bill that passed, and it was Senate Bill 510 that was embedded in the Medicaid Services Conforming Bill. That's gobbledygook for the fact that you need one big bill that's going to take care of what the state's going to do with Medicaid, and also how the money's going to be spent and where it's going to be going. And so that bill became embedded in 5301 House Bill, which was the Medicaid vehicle to be able to put us in a position. We were very pleased that that our kid care bill was moving. However, it got caught in an incredibly explosive, controversial bill that ended up with the counties having to be able to give back some $300 million in payments from not their fault. They agree they need to pay some money in past payments for Medicaid and their hospital share. However, there's a very flawed billing system under ACA, and if you followed in the papers that this bill was being pushed by the counties, our dear friends who we partner with dearly loved that they wanted the bill vetoed. Well, here was this little innocent child in the middle called kid care. And kid care was being held up as the right thing to do to pass that bill that was filled with egregious issues. One of them that all of us that are Medicaid and healthcare supporters, the bill has in it the provision that if you are Medicaid, you only can go to the emergency room 6 times. And then after that you pay for it. Well, now this is all well and good, but if you don't have a specialist that can't see you, this is a problem. We do want to support ER diversion programs, all of those things. They also would only allow 2 doctor's visits a year. So there is a cadre of organizations that are asking the Center for Medicare and Medicaid under HHS in Washington to not allow that to happen. Now, Florida has already won a couple of those appeals. So again, here I say joyfully, sure, 11,600 kids, and this includes now this year children of state employees. And people go, oh, state employees, well, they should have insurance. Well, let me tell you, the majority of workers, public workers in our state are at a poverty level. And this was a win-win in getting this passed because it's saving $300,000 and more of the state in their premiums that they have to pay to cover their employees. So I wanted to just hit on that. There is a resolution on the table because the governor did sign the bill, and with the promise that the Agency for Healthcare Administration is going to be working with every county by code, 67 counties, to work out a fair and equitable billing system. It's flawed, it's broken, and they just need to get it fixed.
And I know we're talking locally about, what is it, about 3 million, or is it more?
Yes.
Yeah, okay.
I think I spoke with Mr. Bruno recently about that, and I'm not sure of the exact figure. I think that is about 3 million. I mean, it's spread throughout the state. However, are they justified? Absolutely. Can it be fixed? It has to be, and it will be. I'm just sorry that our innocent kid care bill that's going to help low-income people
got in it. Let me just say that you're listening to Truth with Gwen Azama-Edwards, and this is WLE, Goliath Radio, 1380 AM on your radio dial in Ormond Beach, Florida. And as I mentioned, my guest is Linda Merrell, who's a child advocate with Florida Child Healthcare Coalition, with the Florida Child Healthcare Coalition, and Lara Glaser. I still want to say Glass because it's G-L-A-S. Okay, Glaser, I love that pronunciation of the Early Learning Coalition of Flagler and Volusia counties. And we're talking about, legislation. We're talking about basic issues that really deal with the healthiness of our children, and that directly impacts the healthiness of course, the families, and it just goes on to the communities as well. And just, bringing a lot of you guys up to date in terms of what has happened, in terms of legislation, what it is that you as parents and as children advocates need to know, need to be aware of, and how you can help, in this whole healthy concept, because healthy is as healthy does, and we as a community, based on the recent stats that have come out, we as a community still have a ways to go. Being middle of the road in terms of our healthiness as a community just goes so far. It just consoles us just a little bit. But if you're the person on the low end of that as opposed to the high end of that, then you can take absolutely no pleasure in terms of how we've come out in some of these standings. But there's so much that can be done, so much that needs to be done. So again, this is Truth with Gwen Azama-Edwards, and we're discussing these health issues. And health, Linda, when you talk about health, I remember a few years back when to bring it to the table of business people, it's just like education. We were saying that education is about economics. Health is about economics, and we know, what's happening with the Supreme Court in terms of the health care bill and the like. But if you don't have, even in terms of education, if you don't have a healthy child that's sitting there, and I think you alluded to this earlier too, and that child then, is, let's say, even so hungry that all they can think about is how hungry they are, so they can't concentrate on school, they can't concentrate on this, they can't concentrate on that. One of the things that was mentioned at the Healthcare Summit had to do with the fact that there is this stress that families deal with, and if they're in, let's say, lower paid jobs, and they're spending a lot of their time thinking about family issues as opposed to being as productive as they can be, and that stress really internally takes its, yes, it's distracting, but it also takes its toll in terms of your body makeup, in terms of your heart, your this, your that, blood pressure, and all that kind of stuff. So all of that impacts that person, which ends up impacting them not just physically, but then they deal with the children, who deal with the this, who deal with the that. So directly and indirectly, health issues are important to all of us,
I think the term that's used so much now is family-centered care, family-centered medicine is what it's all about. When there are a number of other good things that happened, as we were saying that the foster care system, there were some good things that happened under child welfare, or children that are children plus young adults aging out of our current foster care system. There was an effort to reduce that age down to 21 that was defeated, and it remained at 23 with adequate money. There was also an effort
because we have been pushing here to keep it at the higher
Children's Home Society, right? So I just wanted to highlight a couple of these other things that were really kind of good, because it's all health, it's all education, it's all wellness to be productive in a sound economy. You can't think of one without the other.
Absolutely. And it all impacts self-sustaining.
Some of my notes, and so the Road to Independence program is what that's called. And that is going to be something that I know the Children's Home Society will be pleased with, as well as our community. And Senator Lynn has been strong.
And a shout out to her as well.
Absolutely.
She completes her
it's been wonderful. Just
year.
kind of looking at some of my notes here. I did mention the Child Protection Team. That was going to be the whole Children's Medical Services program was going to be dismembered and put out to privatization under the reorganization of the Department of Health. Fortunately, what actually passed with the Department of Health and the reorganization of the Department of Children and Families is much more efficient, and it does not eliminate programs like the Child Protection Team, the examinations on Good Dr. Bell, and So those are some good things.
But we should mention that people should stay vigilant in terms of that, because generally what the legislature tries and they're unsuccessful, they will bring up again.
They're going to have to
Yeah.
really run you for office. You've got it. I mean, she knows. But